And we're very lucky to have Dr. Guggenheim join us, and she's going to be talking about ozone therapy. My name is Phil. I'm one of the compounding pharmacists at Healthy Choice Pharmacy. Great. We've been compounding since 1997. This has become a passion of ours. About 5 years ago, we moved from a retail type establishment to a closed door compounding facility where this is all that we do. It's about 3,000 square feet, it's state of the art, and enables us to help people in ways that we weren't able to do it. Especially as we move forward with genetic testing, we feel personalized medicine is really going to be the wave, not of the future, but currently, and we try not to fit a round peg in a square hole. And some of the ways in which we do that is people have allergies or sensitivities to fillers and things like that. So finding the right medication with the right filler and the right dosage form is what we try and achieve to achieve optimal health. You know, we're all about dedication. We wouldn't be doing this tonight, and we're all about education. And Dr. Guggenheim's going to do that for us tonight on ozone therapy. She educated me and gave me my first therapy to see what it was like. And we create, you know, coming up with solutions for patients is really the key. Collaborating with practitioners and patients and finding the outcome is really great things. Like even this week, we had a patient with scoliosis, multiple surgeries. She couldn't tolerate anything and she couldn't tolerate any base. And we ended up making her medication in coconut oil because that was the only thing that we could do. And it worked for her. She came specifically just to see us. It was really amazing, her story. So she's working out of the Cleveland Clinic, the Mayo. They couldn't help them at all. And we were able to find a solution for her, a partial solution. Corinne? Some of the things that we do here, a lot of women's health and men's health, bioidentical hormones is where we really got started. A lot of thyroid replacement, as Hashimoto's is a huge component with inflammation, customized thyroid, not just Synthroid or T4, it's a combination T3 and T4 or a porcine base. Low dose naltrexone, 25% of the population has some sort of autoimmune issue. And that's where low dose naltrexone can help. So that's 1 out of every 4 people have some sort of issue going on. Pain management, dermatology, and some of the ways that we make these products is suppositories, creams, nasal sprays. It's really about figuring out what that patient needs to get their medication into them. Here's our phone number, email. Obviously, you found our website because you guys registered, but this is a picture of our facility. And now I'm going to turn it over to Dr. Guggenheim. And Dr. Guggenheim was trained as a naturopathic physician and later as a family nurse practitioner. She created Second Nature Care in 2003, a private practice dedicated to identifying and reversing chronic disease patterns. She has helped thousands of patients regain their physical, mental, and emotional health. Known for being thorough, competent, and caring, patients seek her unique brand of care. She has advanced training and certifications in clinical nutrition, environmental medicine, ozone therapies, peptides, homotoxicology, and cancer care. She has shared and taught her expertise in pairing ozone therapies and homotoxicology medicines to doctors across the United States. Dr. G, it's all you.
Thank you so much. I'm so happy to be here. And I refer many of my patients to Healthy Choice because I'm very confident in what they're able to do and how we're able to achieve what Phil was talking about is getting the right medicine to the right patient. I have a lot of low-dose naltrexone patients because they have chronic inflammation. So we're here to talk about ozone. This is actually a little bit different in terms of the slides that I sent. This is a longer version, but I think I'll just talk about that. And many of you, I'm not sure if you're familiar with what ozone is, but it is definitely safe, it's effective, it's proven, it's been in use for the last 150 years. I mentioned earlier to this group that Tesla was the first one to make an ozone generator in the country, in the US. And actually there was a pediatrician who was met with German prisoners of war on Ellis Island and learned a lot about ozone. And then he went on to treat thousands of children with all kinds of conditions, including bacterial meningitis. And because they found that ozone rapidly destroyed bacterium. And then later they found that it also rapidly destroyed viruses and things of fungal nature. So it does eradicate chronic infections, be it viral, fungal, or bacterial. And it also kills cancer cells on contact. So we all have circulating cancer cells in our body. But there's like over 5,000 supports in the literature for this, and including for, our recent pandemic for COVID. There were over 71 human clinical trials around the world that were done, and they were 100% successful. So even with COVID, people in Italy were saved by this. There's a book called Ozone for Life, and they started using it in 18 hospitals right away. Everyone came off the ventilator. Everyone went home except one person who succumbed as they were too far along, but they're still using it even for the variants. So there's a simple question, yes, and we'll get to this likes cure likes. So ozone is actually one of those things because a lot of people felt that it created reactive oxidative species, and they couldn't understand what the mechanism of action was. So if you're creating more oxidative species, how is this going to help reverse chronic disease? But likes cure likes. And so they found this out, that a little bit of ozone in the right dose actually stimulates antioxidant pathways in the body. One specifically, a main one called NRF2. And from that mother load pathway, it then activated all antioxidant pathways in every cell, whether it was your heart, your lungs, your brain, your liver. And that's why it was so effective, that it has, you can take medical oxygen, pure medical oxygen, you then put it in a tube with a spark, and then you create from O2, you create an unstable triatomic molecule called O3. And O3 does a lot of good things. It reduces inflammation because it actually stops all the pro-inflammatory cytokines or chemical messengers. It also is immune modulatory. So if the system is too hyper, let's say in like Hashimoto's, or it's too hypo, it's not working well, it's below subpar. I do a lot of lab testing, so a lot of people have very low immunoglobulins or they have immunodeficiencies. It then is amphoteric, meaning that it balances out the immune system. And it also increases oxygen in every cell. So if you look at chronic disease patterns, there are a few generalizations that you could make. One is that probably everybody who has a chronic disease pattern has gut dysbiosis, and there's a pathogen involved, and they also have oxygen deficiency. So when you treat even just that variable, the oxygen deficiency, people get better. And another piece is, of course, mitochondrial damage or injury or mitochondrial dysfunction. And if you elevate and increase the oxygen in the cells, then the mitochondrial can heal. There's a Dr. Lahudny in Bavaria. He's done a lot of testing on this, and he found that if you did a certain volume of blood at a certain gamma, 70 to be specific, then you actually activated someone's normal stem cells. And as you know, if anybody's familiar with stem cells, to do stem cells is pretty expensive. People go to Panama or they'll go to Cabo San Lucas. But even the starting fee for that is about $5,000. And so this is a much cheaper way to actively stimulate healthy stem cells and your own. The fastest way to increase that oxygen utilization is really through IV ozone. And it really stops it dead in its tracks in terms of the progression of disease and reversing that mitochondrial damage. You cannot increase your oxygen utilization levels through diet or even supplements alone. And Dr. Schallenberger, who was one of my mentors, had proved this point. You really have to, you can't train it away with exercise. In fact, when he did studies on these elite athletes, he found that they were immunosuppressed and they were oxygen deficient. And so that's why a lot of athletes now use ozone therapy, because it allows them to train intensively and also to repair in between the trainings. And you could do beetroot juice, and you can do all these things that are helpful. You can drink chlorophyll, but IV ozone is the fastest way to replenish and activate all of these systems and get the oxygen up, because it happens in nanoseconds. And the ozone therapy, it doesn't care whether you're eating 6 bags of Doritos or not, or even if you have a poor diet, it's still going to do what it's going to do efficiently. The other thing about ozone, which is unlike any pharmaceutical and any botanical, is that it has no receptors, therefore no resistance. You can never get ozone resistance in a body. Whereas sometimes, you might take an antibiotic and you might get resistance to it, or even a botanical you might take over a long period of time, and then the body, acclimates and then just doesn't function as well with that herb. So what does ozone therapy do? It stimulates your white blood cells into action. And then, so this stimulates an innate immune response. It kills, as I said before, viruses, bacterium, and fungi on contact. So it can be used for yeast overgrowth. It can be used for, we've used it with HIV and Hep C patients and also herpes patients. And actually with the HIV patients, they have absolutely no viral load. That's what you want to do, is keep a lid on that viral load. And with Hep C patients, it's proven to be effective. Sometimes some patients we've had to refer out for the standard treatments, but even if you're doing standard treatments, you could pair it with ozone because it makes the treatment more effectively. And that's certainly true with chemotherapy, that if people are doing chemo and or radiation, they're able to complete the treatment because they don't bottom out on their labs with the white blood cells. And they're able to complete the treatment, and it also protects the healthy cells. Ozone speeds down the breakdown of or breakup of heavy metals and petrochemicals and other noxious environmental exposures. It really supports those 2 pathways, detox, like the main ones, like 1 and 2, and then all the pathways in the liver, that it supports the functionality of those pathways so that you can detox. So, and we have it's got to be at least half of the world's population that maybe has an MTHFR defect or difference, or maybe they have a COMT difference, or maybe it's an SOT. So everybody has a different genomic mosaic, and most of us have some kind of dirty gene, as my colleague Ben Lynch has written about. And so, if you have poor detox pathways, you're more likely to be the one who goes in the room and maybe catches TB or maybe catches COVID. I think there's a lot of variables involved with this, but ozone can maintain and improve your baseline of health. It also increases the production of interferon and tumor necrosis factor. So these are normal biological chemicals that allow your body to be more efficacious with the antioxidant enzymes to keep you well. And no matter what the source is, ozone reduces inflammation, and it does it through some very clever biochemistry. It also protects against neurodegeneration, sorry. I've treated patients now post-stroke after they're out of the ICU. And then there are specific medicines I use from Germany for that. We're currently treating a patient who had COVID and got a stroke post-COVID. And so you can regenerate parts of the brain. You could also do it along with peptides. and other supplements as well. But it's the fastest way to do it. And ozone also increases the flexibility and efficiency of red blood cell production. That's really true, and that's important for people who have one of the 6 different kinds of anemias. We just treated someone today who has a blood cancer that is related to an anemia. And so he came in for his first treatment, and already we know that he's probably going to have healthier red blood cell production even after 1 treatment. And it also speeds up the citric acid cycle to improve your metabolism so that you can actually lose weight. So what happens when the medical oxygen turns into O3, then the ozone therapy in nanoseconds creates these peroxisomes or ozonides. And those are the properties that regulate the master detox pathways, not the ozone itself, but it's all the stuff that it creates once it's there. And ozone protects healthy cells. It protects that wonderful phospholipid membrane, that protects our cells. But it really goes after cancer cells and pathogens. And it increases your oxygen utilization in your cells and increases your level of energy. So anybody who has a chronic disease pattern, they have the mitochondrial damage, and they're not producing ATP. They all check off that they have chronic fatigue syndrome. So what we do is we use ozone, and then I use these medicines from Germany. I use glyoxal, ubiquinol, ATP, and coenzyme to rebuild all of those pathways that have been broken. And ozone inhibits the mitochondrial decay, disease progression, and aging. There are people who specialize with ozone with aesthetics, where you can actually inject ozone into the face and, for wrinkles and stuff like that. I leave it to those people who want to sit and do all of those injections. I'm more interested in the bigger, the larger picture of the disease pattern. So I don't use it for aesthetic purposes, but you can. And it really promotes a longer life. So even the things we saw with COVID, when you do any labs on someone who has active COVID, ferritin goes up. It should probably be, well below, like somewhere between 200 and 300. When someone has acute COVID, their ferritin, which is a mirror into mitochondrial damage, I had a patient that went up to 900. So I was very concerned about her. And then the SED rate, or ESR, erythrocyte sedimentation rate, is another inflammatory marker. And that shoots up wildly too. Once, even after 1 ozone session, these things come back down into, and usually a second session to get it back into normal range. So it's a phenomenal treatment that has been well utilized for 150 years, but also could be utilized and is utilized worldwide, except in this country, for the current pandemic as well. And there are different routes of administration. So there are people who do home care that they would do, maybe they would put ozone in their ears. I even treated a newborn who had an ear infection, and the mother didn't want to do antibiotics. And I thought, okay, well, we'll try this. And it cured it. Very relatively simple, and we didn't have to destroy the gut flora of that newborn. You can also do ozone. We used it with a case of a cancer patient who had way too many radiation treatments, and it blew, his immune system was non-existent. It really burned his tissues on his skin and everything. And then he got a little herpes 1 infection in the eye. And then he had a corneal, he needed a corneal transplant. And he couldn't get it because of the herpes infection in the eye. That most people, the corneal transplantation method doesn't work because they have an infection. We did ozone drops into the eye. We also did ozone insufflation into the eye, and we were able to eliminate, and his ophthalmologist followed him as well, so we could document this. It eliminated the herpes 1 infection in the eye so that he could actually get the corneal transplantation. You can also put ozone into the vaginal tract. There's something called a Donati cup I haven't used that, but people will do home care. So if you had yeast overgrowth, something like that, we don't know that it's that efficient for like HPV, cervical cancer. I work with a gynecologist, Dr. Inzenbacher, and at one point we were injecting ozone into the cervix for HPV-related cancers. So that's a possibility. And then there's rectal ozone. And rectal ozone can be effective. It's not as effective as IV, but it can be effective because the question was how much were you absorbing, and were the mucoproteins in the colon neutralizing the ozone? So that was in question for a while, and there was a Dr. Bacci in Italy who was questioning these things. But ozone, rectal ozone, can be an effective treatment as well, and a lot of Lyme patients use it. And so what we do with the IV is that we do a whole consult and intake. We go through a lot of consent forms, and the patient is comfortably lying down, and then a needle is inserted into their vein. We draw the blood out through vacuum extraction. We use a Hermann machine, and then that goes up into a non-toxic eye set. And then we ozonate the blood, and it's a closed container. So even we've had patients who from the Jehovah's Witness community who, don't want any blood products that's against their religious beliefs, and they approve of this method. And then the blood gets ozonated, and the peroxisomes and ozonides then impregnate with the hemoglobin, the oxygen carrying capacity of that blood, and then that's infused back to the patient. And then it goes into the patient, goes through 62,500 miles, and it goes to all the places that your blood would go. So whether it's your nose or your ears or your heart, your lungs, or your eyes. And a quick trivia question, does anybody know what human tissue uses the most oxygen? I'll give it a moment, but I'll also give you the answer. So most people might say the brain, or they might say the heart, or they might say the lung, and those are incorrect. The human tissue that uses the most oxygen is the retina. And that's why it's also important for people to get eye exams and follow up, because there's a lot of health that you can tell through the eye. You can tell whether somebody has diabetes or they have cardiovascular disease. And you can also tell whether the retina has damage or that there's aging. And so the retina uses the most oxygen in the human tissue. It's amazing, right, to know that little fact. So how many people worldwide have macular degeneration? We're treating several people right now. So that is a form of aging, and that it's expressing through the eye. And so we do ozone therapy with that. And then there are medicines from Germany, again, homotoxicology, that I use that are specific for the eye. So I like to think that ozone is a good meal, and then homotoxicology, which I teach to providers around the country, is like a good wine that goes with a good meal. And these are medicines. They're homeopathic. They're made under sterile conditions. They're in ampules, and they are specific for specific indications, meaning that they go to specific places in the body. So there's medicines that I use for reflux, and medicines for COPD, and medicines for chronic infections, and medicines that treating a patient right now with B-cell lymphoma. And so we pair the two together. And then people will say, well, how many treatments, do you need? Well, I think it depends on what your condition is. And then I always order advanced comprehensive labs to see where the patient is, where's their baseline. And I check for like 500 different items. Phil can probably attest to this, that it's a very good baseline to look at all of these things going on, and look at a window into the immune system, and a window into the cardiovascular system, and a window into the hormone system. And, there are specialty labs that might even be better in certain circumstances, but this is covered by insurance. So that's what's so good about it, is that, at least we can get throw a wide net and get as much information as possible. Let me see if there's anything else. The other thing is that ozone, I don't know. It also supports your production of glutathione. And I think everybody knows how important glutathione is as a major antioxidant in the body. And the other oxidative enzymes, so superoxide dismutase catalase, glutathione reductase, glutathione S-transferase, NADPH, quinone oxidative reductase, heat shock proteins, phase 2 enzymes, those are all upregulated through ozone. And ozone also reduces the iron overload. Part of COVID, one of the theories that people died, why they had so many fatalities, that they actually died of iron toxicity. And the increase of the antioxidant capacity counteracts that chronic inflammation that's typical of diseases aggravated by chronic oxidative stress, which I guess you could say really every disease is chronic oxidative stress. So we sit down with the patient, and then we also will rerun labs. Let's say they've done 6 sessions maybe, then we want to make sure that we're going in the right direction. So had an acute Lyme patient recently. It did take him, and it was very acute. Every Lyme band was highlighted, all the IgM and actually IgG as well. And it took 30 sessions. He came every week, was very committed to the process. And now he has absolutely no bands. He's completely Lyme-free. And you can see it clinically in terms of how he presents, but we also have the markers to show evidence that this did work. So I think it's a combination of doing the treatment and then proving that the treatment is working and going in the right direction. And that, it will never be FDA approved. And what's the reason for that? Well, you can't patent ozone. It's natural. So it's never going to be sanctioned by the FDA. But we've also done and been part of what are called IRB studies to prove its value. And then, and we also see the value from patients that they, especially like toxic mold even. I've had patients who are very ill from that, and they were disabled. They were on disability and everything, and they were able to get their lives back. Or somebody who had chronic herpes infection, it would just come out all the time, and they couldn't get a lid on it. And then we would do, once a week treatments for 12 weeks, and then they haven't had an outbreak since. And the other route of administration, obviously, is also injections. So I do that into the joints. I have some people in their 80s that I injected their hips 6 years ago, and we were able to prevent joint replacement. Not true in every case. The other thing is that you can also buy time, but there were really some phenomenal results with that. And we've also injected lipomas, neuromas, and they disappear. So you can do soft tissue. You can also inject into tumors. And there was some cases with that, with also breast cancer, even tonsillar cancers and stuff, but you can inject sodium bicarb, right, and ozone into solid tumors. And that's been a successful method that Dr. Olmedo in Spain has promoted, where he has effectively proved that a lot of these, he was able to eliminate these tumors. So kind of exciting with some of this stuff. I think that I think it's a very important modality. And I think it's even more important when it's paired with good diet and LDN and, getting hormones regulated with bioidentical hormones. I think all of these things can work together, but that ozone can really lay a pretty solid foundation for even other medicines, pharmaceutical or natural, to even work better as well. I just like its efficiency. As a naturopath for the last 20 years, you can tell people to change their diet, and you can tell them to do this and do that. And once they leave your office, you don't know exactly what's going to happen. But what I do have control over is that when they're on the table and I'm doing an IV, I know exactly what's happening, and I know the dosage that they're getting for that moment in time. And I know that it also has a bioaccumulation effect. And so it's a little bit like snake venom, that you really get a momentum with it and it builds on. And then the effect is from weeks to months with ozone. Whereas there's certain things I take every day. I take resveratrol, I take alpha lipoic acid, but for those, I'm painting the fence every day, right? So I get up and I paint the fence each day. Whereas with ozone, it has a bioaccumulation momentum where it actually has an impact. And this is what they studied a lot. The best research in the world has come out of Cuba. And so they would have patients come and they would do whatever it was, their cancer treatment or for rheumatoid arthritis or lupus or whatever, and they would do treatments every day for a month. And then the patient would be released from treatment because they actually had that bioaccumulative effect. So I'm not sure how many other things are able to do that. But I love its efficiency, and I love that it has no resistance. That's just, that's what you look for when you're really trying to reverse chronic disease with people.
That was great, Dr. G. So one of the things I just picked up is I have lipomas, and you think I'd be able to get rid of my lipomas if I did a continuous therapy with that, huh?
I think so, yes. And then there are medicines I would put in, and I could also inject right into the lipoma. So the lipoma, basically, I look at it as sort of
I have them throughout my whole body, not just a lipoma.
Yeah, not just one place, right? So what that tells me is that you may have an inhibited detox pathway, right? So these are like little storage centers of possible toxins, right? So, if you went to a surgeon, right, they say, yes, we could remove it, but then you're probably going to make it again.
It'll grow back, correct.
It'll grow back. And then what they lose the connection with is that, well, what I would do with that lipoma is I get it to a pathology lab. I'd want to check it for phthalates and
mercury and all the stuff that I have.
Mercury, heavy metals, all of that. Most of the time when surgeries are done, they throw the tissue away. Gotcha. And it's a lost opportunity. When it's an organ, you want to do the pathology on it. Gotcha. And find out what's there. And that's also what I think Dr. Fry, I don't know if you're familiar with him, but that's what he does is he examines the blood. So he does DNA sequencing of the blood. I couldn't afford to send what was left in the eye set to him for patients, but what he found is that our blood is very contaminated. Everybody has like protozoas and amoebas, and they have viruses and they have funguses. In fact, when he met with the American Red Cross, within 20 minutes of the meeting, they got up and left because they didn't want the liability of what was in the blood supply. And that's a very big issue because the blood supply, if you don't have to take someone else's blood, don't, because, not even every state checks for Lyme or for some of the co-infections. And then there's always a new emerging virus. We didn't know about COVID, right? We didn't know about Zika. We didn't know about Ebola. So the blood supply and also the sewage system, right? You want to check the sewage system because they were checking that municipalities around the country with COVID because COVID showed up in poop 2 weeks before it showed up in the blood. So bodily fluids are real important. And ozone is a very effective modality for addressing all of these contaminants in blood. And it does it on many different levels, but even just effectively reducing viral loads, bacterial loads, and activating your innate immune system so it can function in a normal physiological way.
Corinne, does anyone have any questions?
Yep. So we got a couple questions, and if you guys have any other questions, please feel free to use the chat function, the Q&A, or simply raise your hand and we'll allow you to speak. So the first question I have is, what should I expect in my appointment and how long does it take?
Okay, good question. So your appointment is usually 2 hours. And a consult is done, and we really are very thorough about going through the consult. And then depending on how many passes that you're doing, there's a thing called 10 pass. So people have learned about this from the internet, and that would be ozonating 2,000 milliliters of your blood. You have roughly between 4,000 and 5,000 milliliters of blood in your body, which is equivalent to about 22 cups, give or take. So a big man might actually have might have 2,500. But if it's a 10 pass, that might take a couple hours. But if it's less than that, and then we base it on, people's budget and, the cost and also their condition. And people do not have to do the 10 pass to get better. So what we do to help people, we'll have them come in, and each pass is equivalent to 250 milliliters. So we'll do that, and that's one pass in an eye set. Then we infuse it back to the patient, and then to help them with budget and everything, we give them a free pass every time. So we don't wait for your anniversary, your birthday, or whatever special happy day. We always give back more to the patients. So they only pay for one pass, but they get 2 passes. So one pass is for free. If they have difficulties with their vessels, like that they really have poor vessel status, then that's kind of a different story, and we have to try and figure out a way. If they're not able to give blood, like let's say they're on heavy duty antibiotics, so they're on chemo, which, disables their ability to give blood, then we do ozonated saline. And ozonated saline has been well studied, including with COVID. In fact, the World Health Organization published several studies to show that you should use ozonated saline with COVID. And I put that on Facebook, and then it was taken down. So, and they told me that I needed to get up-to-date, accurate information about COVID, that I had to go to the World Health Organization. So go figure. But there are also nice biochemical effects from ozonated saline. And it's much more effective than oxygen. It's been well studied in Cuba for that. And it's also more effective than hydrogen peroxide. The problem with hydrogen peroxide and something called DIV, which is direct intravenous injection of ozone, which you don't want to do because that's actually it can be harmful, is that that scars the veins. So for people who've done that method, when they come in and we try to do an IV session on them, we can hardly find their veins. They're obliterated, they're scarred. So hydrogen peroxide can scar the veins, and also DIV. So that's why we use the MA method. And in order to be like a member of good standing in some of these international societies, you have to say that, you don't use DIV. So it's usually a 2-hour visit. And if your blood is running well and you're hydrated, the blood goes up in 4 minutes, it comes back in 4 minutes. So it could be like a 15 or 20-minute process, even a half an hour. If it's going slower, that means there's something, different about your blood flow. I treated a pharmacist once. She had familial hypercholesteremia, meaning very high cholesterol. It was in her family, it was genetic. So when her blood went up into the eye set, all I was looking at was yellow cottage cheese. And our system is set up so none of that went back into her, right? That was actually good that we captured all of that yellow cottage cheese. It was all cholesterol. But that was a different session because there was no fluid. But that's also a beauty of, it's a treatment for cardiovascular disease. It's a treatment for hypercholesteremia. I've reversed cardiovascular disease in patients with IV ozone and the medicines that I pair with it.
Wow.
So yeah, pretty interesting. And sometimes there's a lot of junk and gunk left in the eye set. So I call it like a blood hawker. It would be like as if you were like trying to spit up something in the morning in the shower, right? It's gross. And it's thick, it's tenuous, but our system has a safety feature on it so that the filter doesn't allow all of this stuff to go back to the patient. And then if someone has high ferritin or they have hypercholesteremia, we also do, like, we'll do the session and then we do what's called blood dumping, which they also use that as a treatment in Japan for cancer. But I'll fill I set up with 300 milliliters of blood and then we dump it. You know, I pay somebody then to take that away. So I'm putting, oh, here's a question. How effective is ozone on arthritis? Actually, it's very effective, George. It really is, because arthritis, some components with arthritis, right? You got gut dysbiosis, you've got a pathogen, you have genomics, and you have inflammation. Reduces the inflammation, turns the dirty genes off, changes your intestinal microbiome, and it kills the pathogens. So there are specific autoimmune bacteria in the gut that can lead to both arthritis and rheumatoid arthritis. So one is autoimmune and the other one would be, and for osteoarthritis, I do injections. So into the knee, the hip. I just did someone's shoulder today, right? He couldn't even lift his shoulder like to here at all. It was like almost frozen. So I did an injection into the area. And then even just after the injection, I said, let's take it for a test drive. He was already doing this in one session, right? So arthritis is, I consider it a more of an autoimmune condition. And then you could also obviously do peptides as well, both nasal spray and injectable, but ozone is great because it addresses like the major portion of turning off the machinery that causes arthritis.
Awesome, thank you. We have a question from Lauren. She says, so does insurance cover ozone therapy?
Oh, goodness, no, because it works. It does not cover it. And I know people have asked me, well, can't you put it down as dialysis? You know, it looks like dialysis. The problem is that I can't risk my license. That would be considered insurance fraud. I agree that it should be covered. Now, if you're a Cuban citizen, you get it for free, okay? So if you live in Cuba, Cuban citizens, Fidel Castro, he learned about ozone and he believed in it. So he made it as part of their healthcare system. It's also part of the healthcare system in Germany, I believe, because they have ozone generators in some ambulances in case somebody has a stroke, because it's one of the first treatments they give them, you know, along with maybe standard pharmaceuticals. But if you're a Cuban citizen, yes, you get it for free. You could also go down as a foreigner and then stay. And then I think they have a foreign rate there. It's probably cheaper than what I'm able to do. You know, here I've got malpractice, I've got all kinds of overhead that I have to, and I'm getting stuff from Germany. What we do is any of the medicines that we bring in, we just charge what it costs us to bring them in. So we don't like jack up the cost on that, you know, because we understand that, you know, it's money is an issue. It's just for everybody. And so we try and give as much as we can up to a point, but then there's a thing called overhead. It just, you know, exists. So I can't, if I had a magic wand, I'd do something about it.
Thank you. Next question I have, what conditions do you have the most success in treating with ozone?
Well, we have a number of cancer patients for sure that are cancer-free. And then last week actually had people who they had done chemo, but they're just doing ozone right now, and they just got their imaging back, and the tumors have shrunk 50%. So I would say that it is definitely a cancer treatment. I would say Lyme and Lyme co-infections. It might take a little bit longer. And any kind of, even, you know, whether it's cytomegalovirus, toxoplasmosis, any kind of viral loads, I think it's very effective. Certainly the injections for the prolozone, that's something one should do before they consider any kind of joint replacement. We've treated rare lung conditions. Toxic mold, absolutely. It works, and I think we're at 100% with that. I know we're at 100% with Epstein-Barr. Had one patient who thought she was going to change my numbers, but we still beat it. And so that's been 100%. And because, even addressing Epstein-Barr, this is where I do think that, a lot of people follow the medical medium, and he's brought an awareness about how Epstein-Barr can be a generator for so many autoimmune conditions. I think, and we've had some success with Parkinson's, dementia, Alzheimer's. That I think we've had some success. We've definitely been very successful with COVID. So I've treated people with COVID between 1 and 3 sessions. I've treated long haulers, including children as young as 9, and the long haul. And so I developed protocols for every stage and phase of COVID with the HEAL products, with the homotoxicology remedies. So some people would come in with loss of smell and taste. Some people had body aches. Some people would have lung involvement. Some people had cardiac involvement. What else was it? There was diarrhea. And I was able to reverse all of those. And then long hauler, they just had chronic fatigue. They just couldn't beat it. And I'm talking about people who had COVID a year ago, and it was rough for them. But now I'm finishing up treatment on several people who I'm doing like 6 sessions with them, and they're like different people. It's like meeting different people in terms of their presentation. And then also now, of course, I'm treating vaccine reactions with people. So different things that have come up with that. So I'm kind of seeing the whole gamut from, I think from, bow to stern in a way. Yes, okay, more effective than IV vitamin C. So there's a lot of controversy about vitamin C because it's not vitamin C, it's ascorbic acid. And I think there may be some benefits to it, with acute viral infections, but long-term and for cancer, many people feel that it's a sugar molecule and that it actually could be more inciting to proliferation of cancer. It's just that vitamin C is not a very stable molecule. It would be hard to bottle it up. I think Linus Pauling was correct with vitamin C, but can we get real vitamin C? Can you get it through foods? But most of what we take from the shelf is ascorbic acid. And when someone comes in with cancer, we usually always start them because usually the international protocols are based on have them do as much ozone as possible, especially before they're going to do chemo. Like do 2 or 3 weeks of ozone. And we find that the prognosis is much better than when they do chemo. And their doctors are kind of stupefied that they feel that the patient's doing so well, but it's because they've done the ozone prior to even the standard treatments. But I would have somebody do IV ozone before. And we've done IV vitamin C too. We've even combined the two, where we did ozone first and then they did a bag of vitamin C second. There's a guy, a doctor in my group, Dr. Robert Thompson. He has written a book called The Vitamin C Lie. He's a very, very smart guy. And so he's bringing all these questions up about vitamin C, and he feels that it causes mitochondrial damage and that it's ascorbic acid, not vitamin C. Vitamin C doesn't cause mitochondrial damage. So I think it's an ongoing discussion. But there are people, there are people in my group and they combine it, or they just give vitamin C. But I'm trying to take a second look at it to see what's, the most effective for someone.
All right.
Awesome. Thank you, Dr. Guggenheim.
You're welcome. Thanks.
So I want to thank Dr. G for joining us tonight. Corinne has put up her contact information. We have videotaped, we recorded, not videotaped, the session tonight. It's going to be up on our YouTube channel soon. So if you want to rewatch it, contact Dr. G. I'm sure she'll be able to help you out with the first visit and go from there. And
yeah, and I'm happy to answer questions. Sometimes people just have a question. They're not ready to come in yet. I totally understand that. But if you have, some quick questions, that's fine. Or you can also email as well. And I can assure you, ozone is going to be around for a long time. It's not new, it's old, but I think that it will be utilized in the future. I think it will be utilized in the surgical arena and in hospitals because it could prevent nosocomial infections, hospital-acquired infections. And we need something against antibiotic resistance, right? When I run the GI map on patients, everybody's got antibiotic resistant genes. And because we've used so many of them, it's a scary place. So ozone is one of the solutions for antibiotic resistance.
Right. So if you have any other questions for Dr. G, just email her, or you can quick call. I'm sure she'll take your call. And then next month, we have a Dr. Hal Blattman talking about chronic pain and how to prevent and treat. So I want to thank everyone for joining us tonight. Any questions or comments, don't hesitate to reach out to us, Corinne, myself, and we look forward to seeing you next month as well.
Thank you.
Thank you. Have a good night, everyone.
All right.
Thanks,
Be well.
Dr. G. I'll speak to you
Okay.
soon.
Yes, we get those lipomas.
Yes, exactly.
Well, we can start with one, and we can see, you know, what the results are because it's really pretty.
Now you know my whole thing going on. You got my bloods, you got my ozone, you got everything going on.
I know more than your wife knows. Okay. It's okay. He's safe with me. He's safe.
Okay.
Right. Good night.
Have a good night.
Good night. Bye-bye.